Hi friends, this is a talk about endoscopic forehead lift and how to be efficient. The first thing is really to be prepared, and that's what we're going to talk about. Before that, a little legal stuff though. I do want you to know that I have no financial interest in anything here. I haven't received any payments from anybody, and these are many people's experience gathered into mine that I'm showing here. So what do you as a surgeon want to do? You want to do endoscopic forehead lifts whenever you can. You want to teach the nurses and scrubs how to do it, get all your equipment ready, and make every move count. Now, in order for the circulator to help, she has to lay out the injections before the case, get the endotines and the ointment, lay out gloves, bags, and tape, and get warm water and Physahex. So here are the injections. You want to have both xylocaine and marcaine, 0.5% with epinephrine. And I like to take these and lay them out in 20 cc syringes of the xylocaine, 10 cc's for the marcaine, and I'll put them in a little emesis basin, and that makes them easily accessible and ready to go so that we could get the case started, and they stay sterile. You also have the endotines that you want to get in the room, and the bacitracin. You want to have that all ready. And then you want to take and make sure that somewhere near the head of the bed you put the gloves in the bag and the tape. Now the gloves on the seat make it real nice. You want to have the Physahex and sterile water, and that's warm too. You don't want to take it straight out of the warmer, because if you do, it's too hot. Now you want to get anesthesia going and have them get their Ancef, Zofran, and Decadron out. You want to have them help get the patient's head over the end of the bed, lube the eyes, and secure the tape. Here's their medications that they need: 4 of Zofran, 10 of Decadron, and a gram of Ancef. And then get that head all the way up the end of the bed. What you've got to do is make sure it's all the way over the end, because if you don't do that, you won't be able to get your instruments into the endoscopic position, and things that you just won't be able to do it unless it's all the way at the end, and they'll always check that well. Now, once you've done that, anesthesia should be sure and lube the eyes very well, because you're going to be opening and closing them quite a bit. And particularly at the end, they're going to be wide open even sometimes, and so it's always a good idea for the lubrication. Then you want to tape that tube very securely. It's really important to do that, because if you don't do that, the tube can come out in the midst of the operation, because you are going to be moving the head a lot during the whole case. And I usually like to have them tape it not only once, but also do a double taping, just to be sure that it won't come loose, because that can make it very difficult. And you can see here what they've done after they've taped it real well here and double taped it. You can move the head very well and have plenty of room on either side without any trouble. The tube will be very secure. So now the scrub tech has to be thinking, what should I be preparing? He needs to get the endotine holder and bit, the blades, scissors and elevators, retractors, desumptio, and stapler. And here they are laid out in a kind of minimalist setup. This is the way I like to do it though. Here you've got the endotines with the endotine holder and the extra bit, and you can see that's the endotines. And then the blades, an 11 blade and a 10 blade, pair of forceps, Stephen scissors just as needed. You have a grasper as needed, scissors also to help cut the periosteum, and then you'll need also your elevators. I only use the number 1 and number 2 primarily, but I have the more curved ones just in case I need them. I also have the desumptio marker, the desumptio, and we'll show you how to use that later on. It has those special prongs to mark for the facelift. A retractor, a Sin retractor, is nice to pull it back or make your own, and then the stapler, of course, with a backup so that you don't have to wait for them to open that. You have to also get everything ready for the field. So on the back table you need to lay out your drill, endoscope, camera, some saline irrigation, the under buttock drape, suction, and cautery. So here we go. Here it is on the table. You can see the drill, the endoscope with the light pipe all ready to go. We've got the camera there. We've also got the saline irrigation is ready to plug in. The under buttocks drape is all set, ready to be attached, and also the suction and the cautery. And that should take care of it for your preparation.